This is one area where the federal government is very, very involved under HITECH and HIPAA, and it's enforced by the Office of Civil Rights, which is a federal body, and state attorneys general, which is a more obscure fact for people who don't really follow this stuff. And why is that second part important? Because some state attorneys general are becoming more activist in prosecuting alleged HIPAA violations.
In healthcare, you get compliance drummed into you so much that it's very hard for them to understand risk and to understand that the fact of the matter is that it's a question of managing these risks. They need to understand it. They need to understand that a breach is inevitable. It's happening to them all the time. They don't know how often it's happening to them.
For those of you who are insurance agents out there, they're the ones who get it. They understand the risks, and they should be buying. If they're not buying, they should be. The challenge is that they are very restricted on their budgets. So bring it up in conversation. Let them know what that pricing is going to be, and make sure that they buy it next year, because it's almost inexcusable at this point for them not to have access to a breach response, services or vendors, or at least a reimbursement to cover their cost when they have to notify, because they're going to have to notify people. They're going to have to hire a privacy attorney in order to help them sort it out.
And HHS, the regulatory structure, is different from the better AGs, because the better AGs don't punish you for having a breach. They punish you for not reporting a reportable breach in a timely way, because it doesn't mean that you were bad to have had a breach. But in healthcare, when you have a breach of more than 500 records, you go up on what they call the wall of shame. The wall of shame is and it's universally called that, is an HHS website. And at that point, all sorts of regulatory stuff flows on you from HHS, the Department of Labor, and others.
Encryption is kind of the big watchword now. And there's three spots. One is encrypted backup tapes. One of our, a few of our losses have been where backup tapes were sent by Federal Express and they never arrived. That's a loss. That's information that's out there. Laptops. If there's anybody here that's consulting with healthcare organizations or with anyone else, encrypting laptops is extremely inexpensive. It's $30 or $40.
And is it commonplace? Are you seeing encryption? That's what I'm
more and more and more.
Now they're one of the few groups that can actually answer that question on the app.
Yes.
Yeah.
I consider encryption, and I think you probably do too. I think we all do as underwriters. It is like when you're buying property coverage. It's like having sprinklers in the building.
We see tons of events that are 1, 2, 3 records in the healthcare arena, where a doctor will leave his briefcase on the front seat of his car and someone will smash out the window thinking there's a computer in there, but there are 9 patients' files, or 1 or 2 or whatever. And there were, if you go past the wall of shame and read deep into the HITECH report, there were 25,000 reported incidents that averaged 2.2 records. That didn't, that weren't part of the 500 or more. So you see tons of small ones in healthcare, but you still have an issue to deal with.
An issue that came up on a very large hospital we were working on was an E&O exposure, and these exposures come up in the cyber analysis frequently, and so you need to be attuned to it because you need to address it separately. But they were hosting electronic records for all the physicians in the community, and they were doing this as a fee for service. And we arranged a little companion option for them for miscellaneous E&O. It wasn't a lot of money, but it does need to be addressed. I believe most of these underwriters here could handle that either as a companion policy or as part of their cyber policy if they have the module available.
That's a very important issue. We run into that all the time with all kinds of businesses. Ensuring insurance agencies that have claims, they develop their own claims processing system or certificate processing system. So you should be on the lookout for that. We've seen law firms that develop certain tools to enable the coordination of class action settlements and selling those technology tools. So it does come up.